What is the deal with using straws after bariatric surgery? Most bariatric surgery patients have encountered pretty strong rules or guidelines or prohibitions against the use of straws after surgery, and they may have wondered why. I've wondered why too, actually. My name is John Pilcher. I'm a bariatric surgeon in San Antonio. Now, I started bariatric surgery way back in the 90s because I'm old. And at that time, this rule against straws was already in place. And early in my practice, I followed this rule and I taught this to my patient as something that was a key tenet of success. In other words, to avoid using straws after the surgery is done. There were circumstances that came up that led to exceptions to this rule. There were the occasional patients who really felt like they could hydrate better using a straw, and in discussion I would allow them carefully to make an exception. And then there was kind of a larger number of patients who it turned out as they went down the road that they were using straws pretty regularly. And in both these circumstances, the circumstance where we had a discussion and in the circumstance where patients kind of followed their own path and used their best judgment, in both these circumstances, things seemed to go okay. And so in the late 90s, after a couple of years in practice, I kind of dropped that rule quietly at first, and then kind of in discussion with my patients, actively let them know that sure, however you hydrate the best, including straws or not straws, it's okay with me. And under that new rule, or that more permissive rule allowing straws, we're more than 5,000 patients down the road over the past couple of decades, and I'm pretty sure that none of my patients have had problems from using straws. So for me, this issue had pretty much been put to bed, but it's come back more recently as I've heard more of my own patients asking me the question, what about straws? Hey, I'm seeing in my online support group that I shouldn't use straws. Why is that? Is that important? And of course, I'm ready to educate people one-on-one, but it motivated me to want to put together a little video. And in preparation for the video, I went online to see if there was any scientific research about the use of straws for good or bad, or any complications coming from the use of straws in bariatric surgery patients. And I did not find any formal research with a pretty extensive literature review. I did find that several surgeons have come before me in this process, so shout out to Dr. Matt Weiner out of Tucson, Arizona, shout out to Dr. Duc Vuong out of Houston, and shout out also to Dr. Ben Shadle. And Dr. Shadle, I'm sorry, I didn't catch where you were practicing, but all these docs actually came to the same conclusion that I have, which is that for patients to use straws can be helpful, and it does not seem to be harmful. And before putting together this video, I actually did kind of an informal poll among about 30 leading Texas surgeons. We have kind of a WhatsApp communication group, and I put it out to the group, hey, what do you guys think about using straws for your bariatric surgical patients? And I got mixed responses back. I would say the majority came back and said, yeah, we know about that rule, but we haven't really seen anything that supports it, and we're pretty relaxed about using straws in our patients. A number of responses, perhaps 1/3, came back and said, yeah, we actually think it's important to avoid using straws, and it's because patients can swallow air. In my online research, I also ran across a number of official websites and support groups that do still strongly prohibit the use of straws after bariatric surgery. And when there is a reason that's mentioned, the reason seems to be concern about patients swallowing air as they drink with the straw, more so than if they drink straight out of a cup. I'm going to circle back and take a closer look at this concern about air swallowing, but before that, I want to be very clear that I want you to follow the instructions of your surgical team, no matter how comfortable I may be with patients using straws for hydration. I do think that if you are a patient who has been given a prohibition against straws, and if you feel like straws may be helpful for you in keeping your hydration up, then I think it's fair to ask your surgical team, but once again, I want you to follow their instructions. Now, what about the swallowing air? I think it can come up as a concern in sort of two separate ways for bariatric surgical patients. Number one, swallowing a lot of air can lead to a fullness in the gastric pouch, so it can be uncomfortable. It can lead to kind of a belching thing. And then on a more serious level, I think there could be a concern about excess air causing a leak from your surgery, especially in the first week or two after surgery. And before we go into the question of leak or damage to the stomach, which again I have not seen in my several thousand patients, I just want to look a little bit more at a comparison of how much air do people really swallow when they drink, whether they're using just the cup and the sipping or whether they use a straw. So let's check that out. I mean, when you're using a cup to drink, and this is with no straw, yes, of course, you can drink with very little air and swallow. Now, I was paying close attention that time, and I actually did swallow just a little microscopic amount of air based on the amount of air I had in my mouth as I brought the fluid in. This is a natural thing that happens to everyone. Or, especially if it's a hot fluid, we can get a lot of air. Okay, decent amount of air there. My wife gets mad at me when I drink that way, but you all know what I'm talking about. Now, in comparison, if we use a straw, and paper straw, so it's pretty ecologic. If we use a paper straw, then we've got the amount of air that's in the straw that we're going to bring into our mouth. And we may swallow that air down, but we may not, because the other thing that happens, and if you observe yourself very closely when you're swallowing water or any fluid, you're going to notice that you have the ability, and actually almost a reflex, to evacuate the air or clear the air from the back of your mouth through your nose before you actually swallow the water. So test it out one more time. Okay, and I did clear a little bit of air out through my nose, just instinctively. It did not take a great deal of effort. So I think that the amount of air that one swallows with the straw is not going to actually be substantially different from the amount that you swallow when you're drinking just straight out of a cup using the lid or the rim of the cup. I'll have more to say about the risks of air swallowing in a minute, and they seem pretty minimal to me. But first, there's a related topic where it's very common in the first couple of weeks after bariatric surgery, either the gastric bypass or the sleeve, for patients to notice that they have a lot more belching or burping. And as you may know, all of the air that we burp or belch is air that we swallow. And I was just communicating that we have kind of a reflexive ability to minimize the amount of air that we swallow in most cases. But in bariatrics, it's actually very common for patients to have unconsciously developed a habit of substantial air swallowing before surgery. Why would that be? It's actually most often because of reflux and heartburn. So the deal is, and I'm talking about now before surgery, when people have kind of a reoccurring regurgitation of acid or reflux out of the stomach into the esophagus, there is an instinctive need to swallow and to try to get that acid cleared back down into the stomach. And you can swallow saliva, or you can swallow fluid, or you can swallow food, but also what's easily convenient and always available is a little bit of air. And so many people, when they swallow fluid, or even independent of swallowing fluid, they may swallow a little bit of air. And this reflex, which is caused by reflux, will tend to fade if the patient has a gastric bypass and it knocks out the reflux. But for a little while, maybe the first couple of weeks, that reflex of swallowing excess air will continue. And so when a person swallows excess air above what they need, then that air is going to sit in the little stomach pouch. And what's different about the gastric bypass and the sleeve is that that air really has nowhere to go except back up. Whereas in normal anatomy, pre-bariatric surgery, patients may fart out the air as it passes on through the intestinal tract. Okay, so this condition called aerophagia, which means swallowing air, is pretty common. It leads to excess belching or burping. If that happens, in my experience, that typically settles down over 3, 5, 7 weeks after the surgery is complete. Now coming back to the risks of swallowing air. And knowing how these guidelines are often put together, and knowing my senior surgical colleagues, I suspect that somewhere back in the midst of time in bariatric surgery, a patient had a leak after their bariatric operation, which happens, and it happened more in the early stages of bariatric surgery. A patient had a leak and the surgeon blamed that on a straw. Maybe it happened more than once. Maybe more than one surgeon had a leak, and maybe more than one surgeon blamed it on a straw. And so when that happened, these colleague surgeons in the early phases of bariatric surgery got together and they said, okay, no straws, because it really is a universal guideline. And it's just something that I don't find is supported by our current experience. Let's look at air just a little bit more. What if a person does swallow a substantial amount of air? Is that dangerous? I really don't think so. Air, from a physics standpoint, technically is a fluid, and furthermore, it's a compressible fluid. So as long as the gastric pouch, the sleeve or the gastric bypass, is not pinched off in some way to prevent the escape of the air, this compressible fluid is going to be able to escape before substantial pressure builds up. The most common way for it to escape is belching or burping, but it can also pass downstream. My experience is that air swallowing can make a patient feel uncomfortable and full and bloated, but I have not seen any cases where the air swallowing looked like it was dangerous. By the way, I think that's also probably true of swallowing water and swallowing other fluids. It's actually pretty easy, especially in the first couple of weeks, to swallow enough to feel uncomfortable or bloated or even to regurgitate and throw up. But again, since the water is a fluid and it can escape downstream or upstream, I don't think it can build up enough pressure to cause damage. So hopefully I've been able to set aside the risk concerns that go with using straws after bariatric surgery, but there's another very important angle about using straws as you're drinking your fluids. The question I have for you with your straw is, what's in the cup? So if you're using your straw to drink water or some other healthy fluid, I think that's fantastic. I've got no problem and no complaint about that, but so often straws are not going with water. Straws are going with soda. That big fast food cup, the mega thing, that's going to carry you all day long. But if it's soda, and I don't care if it's real soda or whether it's diet soda, that's poison in your body. So if that's the reason you have a straw, because you bought it at a fast food place and because it happens to come with the straw in it, and it's got the Sonic Ice or what have you, got to put that aside and get back to your water or similar very low calorie fluids. One other note about fluids, what about carbonation? There are a couple concerns with that. First of all, most fluids that are carbonated are soda. I've just spoken against soda very strongly, but there's fizzy water. And what about carbonated water? I actually think that after the first several weeks, and during that time, the water can fizz up in your stomach pouch and be uncomfortable. But beyond that, I think fizzy water can actually be okay. I don't really have a problem with that. And then just one last little topic in closing out. This is kind of on the myth-busting or rumor side. There are also general prohibitions against chewing gum in bariatric surgical patients. I think it's smart to not swallow gum because that might plug up your outlet. It's actually unlikely, but it could, and you just shouldn't swallow gum. Your mom told you that. But I think that chewing gum can be perfectly fine even early on after the surgery. I will say that you should not chew a whole pack of sugar gum because that's bad for your teeth and it's also going to be bad for your metabolism and interfere with your weight loss. But in general, chewing gum after a meal, clean your teeth, keep your mouth occupied, I think those things are okay. So in the long run, pay attention to your body as with so many other things that are bariatric. And if you find that a straw helps you successfully hydrate, I'm okay with that. Stay well. Thank you for watching.